This is Lab Medicine Rounds, a curated podcast for physicians, laboratory professionals, and students. I'm your host, Justin Kreuter, a transfusion medicine pathologist and assistant professor of laboratory medicine and pathology at Mayo Clinic. This episode, we're really kind of continuing this celebration of celebrating the laboratory. And so I wonder if we could kind of get into this by kicking off with, from your perspective, why is it important to highlight the presence of the laboratory in current medical practice?
I mean, I think it's always a good time to sort of remind people that the laboratory, is there to provide, services for our patients. I think the numbers bandied about that, 70% of all, medical information comes from the laboratory. And so, we have a major role in providing data, actionable information to our clinical colleagues to make patient care and treatment decisions. And so with such an important role, it doesn't hurt to get in front of people and raise that awareness again that we are a part of the care team.
I mean, when you say it's providing 70% of the information, that's pretty substantial. But then also to talk about it's a reminder, I guess it's easy to kind of be always counted on to be providing these results in a timely fashion.
Certainly. And I think, COVID was a huge example of getting lab front and center. And I certainly raised the awareness, and at other institutions I've been, the awareness that, at some point in time, the laboratory touches pretty much every single patient in their journey.
Mhm.
And there's not a lot of specialties that can say that, right? So one of my colleagues here says, we are involved in healthcare from cradle to grave, and that actually is to some degree true.
And so for the listener who maybe hasn't thought about the role of the laboratory in their practice, what would be your advice for how to kind of approach building that bridge maybe more explicitly in their practice? I think maybe some clinician listeners may not understand where to start.
Yeah, I would say, please reach out, contact us. We don't bite. We love. In fact, part of our, pathologists oftentimes are introverted, and we need to be brought up. But we are always happy to consult and lend our expertise. We become integral parts of the care team. I think that's one area that we, as a field, our next big push is to become a little more integrated and front and center in the care team. Having pathologists get out and speak to patients is another avenue that is really satisfying, because patients are also curious about laboratory testing and their particular results. And so that's another, way that pathologists maybe have not traditionally been involved in part of the care team, but that's certainly was a very fulfilling exercise for me. Other pathologists actually are involved with that. Transfusion medicine people deal with, more directly with patients and things like that. So I think, as we as a field develop, our next frontier is really to get a little more front and center in the care teams.
Where is the laboratory headed? If you could elaborate a little bit for us.
As we move forward in information, because I think at the end of the day, yes, we're doing all these testing. Our laboratories are generating, like we said, a large chunk of the information being used to treat patients. But at the end of the day, it's information, right? And so how do we leverage that information in new ways to add to, the diagnostic decisions?
What do you think might be our biggest challenge with that step forward into more of that clinic domain?
Yeah, well, I think it's, part of it is, workforce and kind of like keeping people interested in going into the field.
Yeah.
As you and I both know, it's getting harder and harder to find people that get into the field, because, there's so many things people could be doing. And how do we make sure that people understand there's this super interesting career path that is contributing to health of the population, and how do we keep those people interested, and then how do we continue to develop the skill sets that we need in terms of um, information management and computational pathology, which is kind of the new buzzword, right?
Mhm.
And build those skill sets into the training program so that we can continue to grow as a specialty. I think those are things that we will be trying to figure out over the next coming decade.
Why is it important, from your perspective, for us to look at our past when planning for our future?
It's a great question. I think that one of the first things that comes to mind is it's an opportunity to relook at and validate what our principles are. Too often we just keep going down the path. We're busy. We do today, you go to today's list and you do today's list and you worry about yesterday's things you didn't get done. And we don't take the time to really sit back and reflect on what's my vision? What are my principles? And am I upholding those? Are they still valid? Do they still work for us? How can I incorporate them more into what we do? And I think by looking back, you can really go, have I been consistent over time? Have we been consistent over time with why we do what we do? And I think that's a really something we don't spend a lot of time thinking about. But that really should drive what we do. It certainly should drive our decision-making and our planning and our prioritization of things.
How do you see these aspects that you're celebrating informing kind of the future, kind of the future projections of success in our field?
I think we need to move beyond some of our historical approaches to things and really kind of grab that discipline of change and really drive it in the laboratory and challenge how we do things.
How do we shift from service orientation to really being colleagues, equals with our other, healthcare professionals? That's really going to, one, help us to be able to advocate for best laboratory practice to support the clinical practice, but also certainly make us more visible as well.
We need to always think of ourselves that we are every bit as involved with and responsible for and taking care of our patients. And I think that's an important mindset. A lot of these things are the mindsets I think that we need to really work on as a profession.
What do you wish for the future of laboratory medicine and pathology?
I think that as we as professionals become more removed from the patient bedside, we don't have that insight into the patient. We don't have the empathy of seeing what that patient is going through. So going forward, looking to the future, I hope that we as professionals never lose touch with the reason we're in laboratory medicine in the first place. To me, it really made all the difference to have that patient aspect, and it has really informed and truly created the professional that I am today, because I did have that in the trenches experience. And without it, I don't think that I'd be as effective as I am today. So that's one piece, to not let go of the patient piece. And if you have an opportunity to be in a more generalist position and then tie the picture of the diagnostics back to that patient, it actually is going to help you feel like you're adding more value. My hope for the future of our industry and our profession as laboratory professionals, that we are able to bring more people in, advocate for the profession, bring more people in to our programs so that they can actually bring that same joy to the work that we do every day. And then it's not just about the profession. It really comes down to the fact that we are there for the patients, and the work that we do helps provide and improve great patient care, improving the outcomes. And they can't do it without laboratory medicine and pathology.
To all of our listeners, thank you for joining us today. We invite you to share your thoughts and suggestions via email. Please direct any suggestions to mcleducation@mayo.edu and reference this podcast. If you've enjoyed Lab Medicine Rounds podcast, please subscribe. Until our next rounds together, we encourage you to continue to connect lab medicine and the clinical practice, patient care, through insightful conversation.